So now what I want to do is move on to some of the common factors that affect this crisis reaction, and remembering that the crisis reaction really is this disruption between our thinking and our feeling, where the feelings take over and our ability to think diminishes, and that our performance is impacted such that we perform only through a series of trial and error as the crisis is happening, with the hopes it will return back to our effective level of functioning. And once again, being able to look at what some of the factors are that increase this crisis reaction can help individuals identify when they've been exposed to it. And then later in our presentation, we'll talk about some practical things that you can do that if you find yourself having a crisis reaction, that can help return you back to a level of functioning. So some of the operational factors, the things that you do in your day-to-day work that increase the chances of this having a crisis reaction, that disruption, are suddenness. And when I present this to people in healthcare, especially emerge or high intense situations, they say everything we do is sudden. So I'd like you to think about this. How about something unexpected? You come to work knowing that people suddenly show up to an emerge or suddenly can change in their health status. But what if it's unexpected? Just think about the level of stress that that adds. And then the intensity. The intensity really is that for some situations, what might be a normal routine event suddenly has an intensity because of some of the changes in our policies, our practices, the need to use PPE, the social distancing, the availability of maybe even patient relatives or family with them, that suddenly there's more of a demand. It seems more intense. It is more intense. We know that duration plays a huge role in the likelihood of a crisis reaction. The longer that an event goes on, the increased risk of a crisis reaction. And with this pandemic, we don't have a defined end date. But also for healthcare workers, there isn't a defined end of shift hour either. That caregiving role transfers from the job that you do professionally to the job that you do personally. And the duration of always being on, always somebody needing something, can also increase that reaction, that stress. The level of loss can be defined by that this just doesn't affect one small community, one small facility. It literally is enveloping the world. It affects communities at different rates, but there isn't a place to escape it. And that the level of loss, as we see numbers in media of the infection rates and the death rates posted every day, that level of loss is hard to escape. It's hard to turn off. And then age as well. I think that commonly we know anything involving kids, children, is far harder on healthcare, frontline healthcare workers. But we also know that it's any age that you relate to. So imagine for a moment that you're providing care to somebody that reminds you of maybe your parents, maybe grandparents, something that gets personal. An age that you personally relate to can also increase that crisis reaction, the risk of that. In a pandemic, well, guess what? Unlike your regular duties, the risk of injury or death to your relatives, friends, co-workers is substantially higher. And then we talked earlier about this availability of resources, everything from PPE to the number of ventilators to the bed to swabs. The focus on resources right now is constant, and it's really inconsistent with what the messaging is, where the resources are they available, what level are we able to attain, and so there are conflicting messages. With regards to level of education and training, well, first of all, I'm not sure that many people can say that they have much education or firsthand training in this, meaning delivering frontline care during a pandemic where it's intense, it's long duration, and that this is really new. We can be educated about it, but we don't necessarily have experience with it. And so these level of education and training can also increase that likelihood. And then, as I said, stepping out of that door of your workplace into your personal world is harder and harder to do because you're coping with the stress of perhaps loved ones, job losses, changes in the economy, kids being home from school, and you go from being healthcare worker to teacher now, or enforcer of the rules, and that there really is just no time to turn off between shifts. So people are coming to work already feeling exhausted, feeling like they're not coping because there is no time to take for themselves. So those are some of the most common risk factors in addition to what we just described, which were those moral injuries too. Now, organizational stress factors, there's been some research in not only what we do, but the community that we do it within, the organization. And so the workplace influences our psychological well-being. And we know that at times where there are pandemics and large-scale events, disasters, that these organizational stressors, they're not necessarily imposed upon us. They're really a consequence of what's going on around us. But if the organization hasn't addressed it or doesn't recognize it or doesn't take some steps to mitigate it, it can actually in itself be a contributor to a psychological injury and stress. So everything from heavy workload, conflicting roles, these time pressures, and a lack of resources and controls and social supports. Most people are social distancing, social isolating, that we're not able to connect to those staff events, those team events, those coming together in a way that is normal. And so we can feel more disconnected even from our supports in the workplace. I know that in some situations, supervisors are actually working from a distance. They're not on site. And so it can feel like there's a lack of support, that there's a lack of understanding as to what it's like to be at the front lines. And this can be also a lack of feedback, a give and take, a back and forth, the ability to share concerns or to get feedback as to how things are going can be part of the operational stressors. And at this time, major decisions are being made on a larger scale, higher up in the food chain, where there can be a perceived lack of participation in these decision-making. You're front line, and maybe there's a perception that we're not being asked what we need to do our job, that there's a feeling that people aren't taking that into account. There's just the expectation that we should show up and do it. We know that any job that requires the emotional empathy can really take a toll, that in the routine job, part of your role is to have that emotional empathy for the people that you work with and care for. That can also take a large toll. And then this lack of sufficient rewards. And for most people, it's interesting when they looked at what people wanted from their organization. The first two say monetary and social, belonging to a larger sense of community, being a healthcare, being a nurse, a respiratory therapist, whatever it is, has some degree of I feel good about belonging to that profession. How I get paid, we should all get paid for the work that we do. But most impactful is this intrinsic sense that what you're doing has value. That most people will say of all the three types of rewards, the lack of intrinsic reward, feeling like it is all for naught, feeling like there is no benefit coming from it, is one of the largest stressors that people report, even more so than money or that sort of social aspect. There was a more recent study that sort of distilled these down into, in Canada, what are some of the organizational factors and stressors today that seem to cause the largest degree of stress in our frontline workers? And that includes inconsistent leadership, bureaucratic red tape, dealing with coworkers, feeling like different rules apply for different people, and feeling like you're always having to prove yourself to the organization has sort of been added to that list as sort of society changes and demands change, that these now come in addition to those other organizational stressors that we just talked about. So any questions or comments about organizational stressors, operational stressors, and how they impact frontline healthcare workers?
I think from my standpoint, I mean, we work for a very large organization, and so sometimes we get information from outside and we're still waiting for the organization to give us the direction. And I know from a leadership aspect, I want to give staff the best information possible, but it really has to be, I need to have direction from AHS. And so sometimes it's waiting. And so staff can get frustrated because sometimes the larger organization does take a little bit longer to get information out than the media is already down our throats about something. So it's really about, let's make sure we have best practice. We want to have best practice, and being able to kind of hopefully be a couple steps ahead of things, so staff aren't getting frustrated because they need information now, and sometimes there is a delay because of the infrastructure that we work in. And eventually the results are excellent and we have best practice being promoted, but staff are, I think, needing it before it's able to come out in a official document sometimes. So
Yeah, yeah, we again are really familiar with the aspect of that flow of information, and to find out from an external source what's expected of you at your job that hasn't been communicated internally can absolutely add that stress. And that getting and giving different opinions inside and outside the organization and the communication of it. The other thing, as a healthcare professional, you're bound by confidentiality, but also sort of standards and practice, where it's really hard when you hear inaccurate information to stand up against it. And for a lot of people in healthcare, it's a feeling of that if things are said that aren't accurate, there's no way to stand up and change the public perception, and make it more accurate. And those are some of those added levels of those organizational and communication aspects that we routinely hear about as sort of tipping people over the edge, to really that they could cope with everything except when they go home and hear inaccurate information that they feel powerless and helpless to counteract.
Just to add to that, even within our organization, when we land on a final, there's another group that doesn't quite agree yet. And so like it's been so, speaking from my perspective, for the last 4 weeks, the conversations have been so cyclical because it's so difficult to make massive decisions that we are being asked to make and that we need to make with such little tangible information, very little research in certain fields, and we're being asked to make these massive decisions. And so of course we're going to have different pockets who believe in different practices, and so that's been a massive challenge. And then Jeff, just to speak to something else that you were talking about, is I don't like to reinforce stereotypes, but as a frontline worker, you often have a sphere of control that is your patient family, your unit. And I think one of my friends, when I was asking her this question today, just before the webinar started, she shared with me a statement that really resonated with her, that she had heard from someone else, that the illusion of control that she felt that she had has been removed.
Mm.
And so it's not a easy place to be when you feel so out of control of so many things in your personal, professional life.
Yeah, and I think that going back to the beginning, being able to say you don't just step out of your work environment into sort of an organized, controlled world. You step out of one type of chaos into another form of chaos. How we buy our groceries, how we teach our kids, how we walk on a sidewalk. All of these things have been disrupted. So people keep talking about a new norm. And I think that there is no such thing as a new norm. It really is adapting, because that norm is constantly changing. How we pay for our groceries, how we walk up and down the aisles, simple things like that, we now have to think about. And it's hard enough to do our job and think about those technical aspects of patient care and our professional conduct, to then leave there, and these routine things that we normally do that give us a sense of comfort are so disrupted as well.
And Jeff, like, just to when I was walking through like even ICU and Emerge and just even in my own RT department, I was just thinking about all the different healthcare professions that are involved in this COVID-19 response and the increased responsibility that everybody has to take on. What was interesting was like even say like even like a physiotherapist on the floors might have to start doing some of my roles as an RT, or even like healthcare aides having to take on increased responsibilities, or even like the unit clerks or LPNs, RNs, like all the health professions having to take on way more than what they're normally used to, and it's out of their comfort zone.
Yeah, really taking on those roles that people weren't trained with or trained for, that they might even be outside their scope of practice on their normal assignments, but now it's stepping up and taking on those roles. And I think that there's a degree of professionalism and wanting to do right, and knowing that the consequences in healthcare of doing something wrong are grave, that people want to do the best, but um, not necessarily having that reassurance that they have the confidence in knowing what they're doing and what their normal confidence level is, that says that they are going to make that positive difference rather than an error or mistake or have an adverse outcome. Yeah, it's a huge stressor right now that we're hearing.
Actually, I just wanted to comment one more on what Nicole had commented about us living in our patient and our own departments. We've really had to expand our viewpoint because, especially with Emerge, we connect with every department, and you don't think how even afraid that the porter is. I normally just pass my patient to a porter, they take them someplace for me, but they also have their own fears and anxieties about what it means for them to be transporting. So we've had to really collaborate with every department throughout our entire hospital to make sure that we're all on the same page, that we're all making sure that everybody feels safe, and that we're all making sure we're passing on the same information. So it's been a huge, from an organizational perspective, a huge workload just to get everybody on the same board. So yeah, it's been interesting.
And I think that it's being able to sort of say it's a ripple effect of impact, that suddenly we have people who do a job that is being pretty routine, as such as a porter, who suddenly has to become almost an expert in their own sort of safety and virus transmission and donning of PPE and all those different things, which again, they may not even have gone to the job thinking that they would ever be required to do this or exposed to it, and it's pushing their personal limits.
Mm-hmm.
I think also this is a vulnerable population that when they go home to perhaps their family that doesn't necessarily understand, we're starting to see even more and more of that sort of stigma and that isolation, and seeing people as a risk, and people really misunderstanding, and so it just really is that snowball effect.
Mm-hmm.